Good afternoon and welcome everyone. I would like to start off by thanking the media here today for your continued efforts in helping us share the latest facts on COVID-19 as the situation evolves. Thank you also to Mayor Tory, Councillor Cressy, Chief Pegg, and my many city colleagues joining me here to share an update on our COVID-19 response activities underway in Toronto. As you know, I've been keeping you informed on COVID-19 since we first learned of our first local case, back in January. I've been updating you on our case and contact investigations and providing you, the public, with advice on how best to protect yourself from COVID-19. My message to you has been to practice good infection prevention and control activities, such as vigilant hand washing, as an important way for you to do your part in delaying the onset of community spread of this virus. My team continues to carefully monitor virus activity and transmission around the world to help inform our local actions. Yesterday, the World Health Organization characterized the current COVID-19 situation as a pandemic. This means that COVID-19 is spreading across multiple continents or worldwide. Here in Toronto, what we've been seeing is an escalation of imported COVID-19 cases. That is, cases that are related to travel outside of Canada, including the United States. At this time, we are still not seeing confirmed evidence of local transmission. However, it is important to note that we are making decisions for a rapidly evolving situation based on the evidence that's available. With this in mind, I am making recommendations here today so that you in our community can also do your part to minimize local transmission. I am asking you to carefully listen to this advice. The new cases that we are seeing in our community are from people arriving in the city from outside of Canada, including the United States. For those of you who have traveled, we need you to be extremely vigilant and carefully monitor yourself for signs and symptoms of respiratory illness for 14 days after returning from travel. Should symptoms develop, we ask that you stay home and contact public health for further instruction. We're also asking returning travelers to avoid group interactions and public gatherings wherever possible. Travelers are also asked to avoid visiting with elderly people and those with chronic health conditions for that 14-day period after returning from travel. We ask this because those who are older members of our community and those with chronic conditions are more sensitive to serious COVID-19 infection. COVID-19 spreads through the direct contact of respiratory droplets, cough or sneeze of somebody who is infected with the virus. This usually happens when a person spends 15 minutes or more with an infected person within a distance of 6 feet. Event organizers and businesses can also do their part in reducing virus spread by promoting social distancing measures. The Public Health Agency of Canada recently published a resource that outlines risk considerations to help decide whether or not to postpone or cancel an event or gathering. So we are asking, if you have an upcoming event planned, please use this guidance to assess if your event can be postponed or held virtually. for individuals who've been asked to self-isolate, or for individuals who've been asked to stay home if you're sick. I know this is difficult. This is why we are working with others to create supportive policies to make it easier for people to self-isolate or to stay home when they're sick. At this time, I am also asking you to change some of our behaviors, such as avoiding hand-to-hand contact through shaking hands. Even though this is part of our business and social culture, I am asking that you adopt this behavior to prevent the spread of COVID-19. People who have traveled in Italy, Iran, or Hubei province in China within the last 14 days are to self-isolate and contact Toronto Public Health within 24 hours of arriving in Toronto. The Public Health Agency of Canada also now recommends that Canadians avoid all cruise ship travel due to the ongoing COVID-19 outbreak. Locally, as of this morning, we at Toronto Public Health are monitoring 29 positive cases of COVID-19. To date, there have been 4 other confirmed cases reported in Toronto. All 4 of these people have since recovered from their illness. At Toronto Public Health, when we're notified of potential COVID-19 cases, we carefully assess the potential health risk of each individual situation. We then provide education and further instructions to reduce the potential of virus spread. Me and my team, we continue to receive many questions about potential COVID-19 exposures, and so I'd like to take this opportunity to clarify that those who have been in close contact with someone who does not have COVID-19 but was exposed to someone with COVID-19, these people do not require specific public health follow-up. I think this bears repeating. Those who have been in close contact with someone who does not have COVID-19 but was exposed to somebody with COVID-19, these individuals do not need specific public health follow-up. I would encourage those individuals, of course, to engage in good hygiene, good hand washing, and good preventive measures that prevent the spread of respiratory disease. But these are good behaviors that should be taken at all times. My team is carefully monitoring for cases, and we continue to expand our public health operations as our local situation changes. We're also actively working with city and health sector partners to plan for potential local spread, which we expect will eventually occur. We in public health, along with you, our community, we all have a role to play in managing this situation and in delaying community spread for as long as possible. As always, staying informed with credible information sources is also very helpful. In recent weeks, I have seen people making some very good decisions in response to their activities and the situation that we see unfolding, and I am asking that people continue to take this very responsible approach. These measures may seem simple, but they are actually very powerful actions that people can take to protect their health and the health of those around them. Together, they can help us delay the onset of community spread and decrease the impact of COVID-19 on our community at large. I will continue to keep you updated as new facts become available. In the meantime, I encourage you to continue to stay informed by regularly reviewing evidence-based, credible sources of information regarding the COVID-19 situation. Thank you for your attention, and I'll now turn it over to my colleague, Chief Pegg.
Thank you, Dr. De Villa. Good afternoon, and thank you for being with us today. As you've heard me explain many times during a wide variety of emergencies, our media partners play an important role in helping us connect and communicate with our residents. Since the inception of the COVID-19 public health issue globally, the City of Toronto, under Dr. De Villa's leadership, has been proactively planning and preparing. This planning work has been underway since mid-January, with the city's emergency management and senior leadership teams being connected with Dr. De Villa's team on this issue. In addition to my role as Toronto's Fire Chief, I am also the General Manager of the City's Office of Emergency Management. The City Manager has asked me to assume responsibility for leading and coordinating the City's response to COVID-19 in support of Toronto Public Health. The City of Toronto is well prepared for both emergency management and emergency response. We have robust emergency plans in place that position us well to respond to this pandemic. Our emergency incident management systems are both scalable and nimble, in that we are able to both plan for and respond to situations as they arise. As you know, our Emergency Operations Centre is open and has been operating at Level 1. We are now transitioning to Level 2 operations. This will provide Emergency Operations Centre coordination and support to our city divisions on a 24/7 basis moving forward. This means that our Office of Emergency Management teams are fully engaged in supporting both Toronto Public Health as well as our citywide COVID-19 task force. The task force is a team of approximately 50 people from each and every city division and city agency who are now working on COVID-19 planning and response on a full-time basis. The task force is working on a number of important plans in preparation for the potential escalation of the COVID-19 situation. This includes outlining what service levels can continue to be met in the event, let's say, that 10, 25, or even 50% of the workforce is unable to come to work due to illness. This also includes developing comprehensive contingency plans in the event that critical supplies like protective masks and other personal protective equipment that our first responders and frontline workers need aren't able to be delivered due to supply chain issues. That is a very real issue that was identified some time ago, and we continue to work through it. The availability of these types of personal protective equipment is not a Toronto issue. This is a national and even global issue that we are actively planning for. In all cases, the city's response to the impacts of COVID-19 must be scalable. We must be able to both ramp up or ramp down as circumstances change, be nimble in the face of that change, and importantly, be coordinated as an organization. These are the same emergency planning and emergency incident management processes that we implement thousands of times each year across our city. The same processes that are implemented inside mobile incident command vehicles during major fires and other incidents are being implemented now on a citywide scale within the Emergency Operations Centre and by our COVID-19 task force. The City of Toronto is prepared to plan for, manage, and respond to these types of situations. This is precisely what we do. For any emergency, whether a natural disaster, a fire, or a pandemic, we plan, respond, and adjust the operational plans in live time, based upon the situation that presents itself. As we have seen with COVID-19, the circumstances are changing not just daily, but hourly. To that end, the city must be flexible in how it responds, maintaining public safety, continuing to deliver essential public services, and ensuring that our staff are appropriately protected are the priorities. City services that can be maintained during the pandemic will be. Services that may need to be adjusted or suspended at some point will be determined as the situation and risk factors evolve. To that end, the City of Toronto is actively evaluating each of the scheduled public meetings and city-operated events against the mass gatherings risk assessment process that has been provided by Public Health Canada. In the event that any city-operated public meeting or event is determined to pose a risk of COVID-19 transmission, actions will be taken to mitigate those risks. This could include transitioning to virtual meetings where possible, or postponing meetings in the event that that is not possible. The assessment of each scheduled public meeting and event is ongoing now, and information relating to any changes that need to be made in the best interest of public health will be communicated as very soon as possible. Further, effective immediately, all non-essential business travel will be cancelled for all City of Toronto staff on a go-forward basis and until further notice. Each and every division in the City of Toronto has comprehensive business continuity plans in place. This provides us with a solid foundation from which we are now building COVID-19 specific plans. The COVID-19 task force is enhancing the existing plans for all of these scenarios, identifying any gaps that may exist, and are working to ensure that those gaps are filled. In practical terms, here's what we're doing. Coordinating the planning efforts of city divisions, including city agencies such as the TTC, Toronto Police, Toronto Community Housing, Toronto Public Library, Exhibition Place, and the Toronto Zoo. Identifying critical needs, like the continued supply of personal protective equipment for first responders and other frontline workers, including senior services, long-term care, and Toronto Public Health staff, and actively applying the mass gathering risk assessment tool and making decisions based upon the outcomes of those assessments. But as I said, this is a fast-moving situation, and we are working diligently to remain prepared and to respond as required. We will share accurate and transparent information with you. You know that as the fire chief, it has been my commitment to you in the past. This has been my commitment to you in the past, and this will continue moving forward in this role. COVID-19 is a public health issue that impacts us all. My team and I are here to work with Dr. De Villa and the Toronto Public Health team as they work to support the people of the city. Thank you. I'll welcome Mayor Tory.
Well, Chief and Dr. De Villa, Councillor Cressy, ladies and gentlemen, good afternoon. I want to thank, first and foremost, Chief Pegg for agreeing to accept this assignment to lead the next stage of the city's ongoing planning and response to COVID-19. And I want to, at the same time, recognize the continuing and tireless work of Dr. De Villa and her team. She'd be the first to say again that she has been doing this work. She's been the leader of a great team of public health professionals and other staff who have, I think, managed this very well on behalf of the people of the City of Toronto thus far. Through the course of the COVID-19 history, Toronto's response has been professional, it's been well planned, and it's been measured. And I think today fits within that context as well. Today's announcement, including Dr. De Villa's frank and professional advice to the people of Toronto, is a reflection of the evolution of the city's required and ongoing response to COVID-19. Today's steps are a deliberate but appropriate response to a rapidly changing situation, with our objective being, as it always is, to protect the health of Torontonians and to contain the spread of this virus. As we've seen in the last 24 hours, this situation is changing extremely rapidly. By assigning Chief Pegg to lead our Emergency Operations Centre, we've made a carefully considered choice of an official who can effectively lead the coordinated efforts of the city as new requirements arise out of new developments. He will continue with the ongoing task of making sure that all city departments and services and all city agencies are working together to respond to this pandemic and to protect the health of Toronto residents. I want to echo Dr. De Villa's advice to people and organizers and organizations. Just as government has a role to play in responding to this situation, individuals also have a responsibility as good citizens to make personal choices that help minimize local transmission of COVID-19. People have helped up to this point by remaining calm and following the advice of our medical and health professionals. We need that calm and responsible approach to continue. We need people to think first about their responsibilities as citizens. For those who have travelled anywhere outside Canada, as Dr. De Villa said, that means avoiding, where possible, close contact, especially in crowded events or with high-risk populations such as the elderly, if you've travelled anywhere outside Canada recently. It means if you're a returning traveler not visiting hospitals or long-term care residents. It means if you're an event organizer, whether festivals, parades, public meetings, or other such events, assessing the possible risk carefully and giving consideration to the postponement of the event. And in that context, I appreciate the difficult deliberations and the decisions that have been arrived at by organizations, including some of our sports teams and the organizers of the St. Patrick's Day Parade. People should also, as Dr. de Villa said, pay very close attention to their own symptoms. Nous demandons aux gens de Toronto d'être de bons citoyens. Nous leur demandons s'ils ont voyagé à l'extérieur du Canada pour éviter les scènes de grandes foules, les personnes âgées, les hôpitaux et les résidences pour personnes âgées. Nous demandons qu'ils organisent de grands événements de toutes sortes, de réfléchir à la façon de garder les gens en bonne santé, y compris le report de ces événements. As Chief Pegg explained, we will be applying the very same criteria to City of Toronto public events over the coming days and weeks to encourage appropriate social distancing within the context of where Toronto finds itself today. The changes announced today and the updated advice from Dr. de Villa will allow the City to respond to what is an ever-changing situation even more quickly for the safety and protection of all those who call Toronto home. I'm confident that we have learned the lessons from SARS and we have the best health system and frontline workers in the world. But we know that this is a challenging time for countries and in particular cities around the world, including our own. It continues to be critical for people to make decisions and take action based on the advice of knowledgeable and credible public health experts. And we will continue to do so as city officials and continue to make sure that our public health experts are providing all the facts to us and to the public as they have done thus far. I also want to thank the media for the work that they have done and you have done so far, and the work I have no doubt you will continue to do getting the accurate information out to the people. There are no substitutes for the work that is being done through the media itself beyond the things we try to do through websites and call centers and so forth to make sure people understand what's going on and what advice we collectively have for them. Along with continuing to make sure that Dr. de Villa and now Chief Pegg have everything they need for Toronto to continue to respond to COVID-19, I will also be focused on protecting our city's economic success throughout this situation. These events have already extracted a heavy cost, from conferences cancelled to restaurant tables not filled to hotel rooms that are empty and to workers' hours that have been lost and will be lost. And that total cost will expand as we exercise greater care, as we're discussing today, and as the days pass. I will be leading an effort out of City Hall, first to fully understand and quantify this economic impact and to determine what governments can do to protect jobs and to protect the economy. I will be doing so with the help of Deputy Mayor Michael Thompson, the chair of the city's Economic and Community Development Committee, and city staff, along with our partners at organizations like Toronto Global, Tourism Toronto, and the Toronto Region Board of Trade. This is a time when all employees, all businesses, all of our residents have to know that governments have their backs. I will continue to ensure that our municipal government works effectively and cooperatively with both the Government of Canada and the Government of Ontario to provide that coordinated response that protects residents and businesses the best. It takes a united effort between all of our governments to address these undoubtedly serious health and economic issues. I've already had conversations with federal and provincial finance ministers in recent days on behalf of the City of Toronto concerning this matter, and I expect that that dialogue will continue. I also want to thank Premier Doug Ford, with whom I spoke within the past hour, and Prime Minister Trudeau for the measures already announced by those governments aimed at funding the ongoing public health response, protecting those individuals who may have to undergo self-isolation, or protecting employers who are seeing negative impacts on their businesses. It is encouraging that both leaders have committed further help as needed. And I want to acknowledge in that context the province of Ontario's movement forward with the opening of provincial assessment centres, the expansion of lab testing, and its confirmation today that it is extending public health mitigation funding by an additional year. Our city is strong. It is strong in many different ways. It is also, as we say often because it's true, it is the economic engine of Canada. But that strength and that success built on the fact that during tough times, governments work together to first and foremost take care of the people, but also to protect the economy. That kind of working together and standing together in difficult times must continue. Once again, I want to thank Dr. de Villa and her dedicated team at Toronto Public Health, our Office of Emergency Management, and the many city divisions that are contributing to our ongoing response to this matter. I would also like to thank, in particular, our healthcare workers across the city for their ongoing efforts. And I will now ask Councillor Joe Cressy, the Chair of the Toronto Board of Health, to say a few words.
Well, thank you, Mr. Mayor. And first to Dr. de Villa, the people's doctor here in our city, and her outstanding Toronto Public Health team for their relentless work. To Chief Pegg and our entire City of Toronto senior leadership team, many of whom are here today. Listen, for 2 straight months, there has been aggressive global containment efforts. And here locally, for 2 straight months, we have worked rigorously both to contain and conduct contact tracing in Toronto. This has effectively delayed transmission, but the truth is, viruses do not respect borders. Despite both global and local efforts, we have clearly entered a new phase. And in response at the City of Toronto, we have in turn scaled up our work in activating our Emergency Operations Centre, both to mitigate harm, but to importantly protect the health and well-being of our residents. So as the Chair of the Board of Health, I want to be very clear. This global pandemic will test us. It will test our public health systems and our provincial healthcare system. It will test our economic resilience. It will test our city, not just our capacity to continue delivering services, but also our ability to adapt all frontline operations to prevent transmission and our residents. But finally, this will test us as a society. It will test our ability to not succumb to misinformation nor to succumb to panic. We must remain calm in the face of a storm at all times. We live in an interconnected world where a virus that emerged just over 2 months ago, can jeopardize services, the economy, and indeed our sense of individual safety and security. But I want to be very clear. Toronto will rise to this test. Since 2003 and our experience with SARS, we have developed preparations and scenario planning to put us in a position where we can confront and respond to any pandemic. 2 months of non-stop citywide preparations and scenario planning have put us in a situation where we are ready. Under the leadership of Dr. de Villa and with Chief Pegg at the helm, we will protect the residents of our city and support our economy. Let me close simply by saying that COVID-19 is an international issue. Global public health is everyone's business, and we are, as a globe, all in this together. And in the City of Toronto, we are going to continue working 24 hours a day, each and every day, to keep our residents safe. No resources being spared. We will continue to base our actions not only on evidence and science, but the best advice of our experts, some of the world's best being right here in Toronto. But it's important to understand that this is a marathon. This is not a sprint. This virus is not going to go away today, tomorrow, next week, and maybe even not in a few months. But as a city, we are prepared, we are ready, and we will meet this test. On that, I'll turn the floor back over to Dr. de Villa, Chief Pegg, and the Mayor, and we'll open it up for questions. Thank you.
Yes, I think it's on. Can you hear me? Great. What we're hearing right now from a lot of health officials is that there needs to be less choice. We're hearing things today about assessing risk and leaving it up to people. You're giving guidelines, but essentially leaving it up to the public to decide how they want to handle this. In New York, we're seeing bans on gatherings over 500 people. We're seeing a government response that's saying this is what we need you to do. And what I've heard from clinicians here, aside from this press conference, is we need to mandate more of those things potentially and give people that guidance instead of leaving it up to sort of a free-for-all. Do you think that we're at that point here in Toronto where, the municipal government needs to be mandating more of this, not just suggesting things?
So thank you for the question. I think, in fact, what I've characterized is the very guidance that you're talking of. That guidance is being provided. We have a guidance tool and document that's been put together by the Public Health Agency of Canada and actually takes into consideration all the unique circumstances. Bans are fairly blunt instruments. I think that where targeting can occur it often provides the best result. That being said, I know that there are conversations happening, around the province, and I know that our provincial colleagues are engaged in significant discussions around how to escalate and how best to do so. Because when we're talking about broader scaled public health measures, clearly those kinds of things are more effective, just given the circumstances in our city, how we move about, how we live and work and play in and around this part of the province. The movement is back and forth. So you can well imagine that those kinds of public health measures are likely to be more effective if done, on a larger scale.
That being said, are you comfortable with the direction from the province right now? Are they being as blunt as you are about what needs to be done?
My sense is that those conversations are actively happening. We're having some conversations with them. I know that they're having some conversations amongst themselves, and I look forward to hearing what they have to say at their next public press conference.
Chief Pegg mentioned some city services that would be maintained, talking about what the emergency center is doing. I wonder if you could be a little more specific, given that there is perhaps misplaced fears, and in that context, the kinds of city services that residents should expect to continue. Do people need to be buying bottled water because their water won't be running?
Sure, thank you. So I can say that at this point in time, there has been no public-facing, no outward-facing reduction in service. So the services being provided in the city right now are stable and being maintained. As I explained in my comments, we are very much in a process now where, as this situation changes, and I can tell you today it's changing hourly, as the situation changes, that is constantly being reevaluated. If we reach a point in time, and if Dr. de Villa and her team provide us with the expertise and the expert advice that suggests that we need to alter frontline service delivery for reasons of safety or for reasons of that maybe as a result of being unable to do that, deliver the services for staffing reasons, for example, we'll make those decisions then. But at this point in time, I would say we're safe, we're in a good place, and our plans are in place. We are, the goal of the Emergency Operations Center, of the Office of Emergency Management, and now the COVID-19 Task Force, is to plan proactively and to be as very prepared as we can be in advance of any of those things having to happen. That work is happening on a full-time basis, and I'm very confident that we'll be positioned to react accordingly.
Ottawa Public Health put out a checklist just hours ago, advising some things that people might want to stock up on, but in a sort of tongue-in-cheek way said, you don't need 670 rolls of toilet paper. And I just wonder if there's any reassurances for the public who are at home listening to you and wondering, do I need to go to the store now? I'm hearing officials saying that we've reached a new phase. If you could provide those specifics, I know that you don't want to necessarily say, do this, do this, do this, but some basic things. Will the water be running? Do I need 670 rolls of toilet paper?
Well, I think at this stage of the game, we're talking about, community spread and increasing spread of this virus. And so what that means is that there is an increasing likelihood that people here in our community, whether it's ourselves or our household members, are likely to experience illness at some point in the future. So when we think about that, and we think about that with a preparedness mindset, what I would suggest is that now is a good time to reflect on what are the daily needs of your household? What and how would you manage those needs in the event that you or someone in your household were to fall ill? So it's that kind of preparation activity. For some, checklists are reassuring. For others, they prefer to go a little bit off on their own playbook. But I think that that's why it's important for people to just reflect on what their household needs are and how they might actually meet them and how they can prepare for them in advance should they themselves become ill or someone in their household becomes ill.
Sure, thanks. I should just respond directly to your question about concerns around Toronto Water. I can assure you, Toronto Water is absolutely business as usual. They are connected. We have representatives from Toronto Water, of course, working with us on the COVID-19 task force. And like every other city division, the planning is in place. But important for all of us to know, there is no imminent risk. There is no threat associated with water. Our water supply is candidly one of the best in the world and is safe and will be continued. The way that any pandemic response plan or any response to any emergency, frankly, works is in the event that we have to start to scale back city services, that will be prioritized on the basis of non-essential services first. In essence, our plan always has been and always will be, we will redirect every resource we have to the delivery of frontline public services that affect public health and safety as a priority. So I have no reason whatsoever to believe that we are at any risk or have any concerns related to our water supply.
Mayor Tory, if you would, as you're probably aware, an hour before this press conference took place, QP Local 79 also held a press conference. Their president had said things aren't any closer. There's a chance that no deal will be done by the deadline this weekend. How is that going to impact potentially what we're talking about today, should there be a work stoppage?
Well, I will just say that we're continuing to negotiate. And I guess when these kinds of talks are going on, and we've discussed before, the rhythm that they often have that sees it go closer to the end of the period that you have before a deadline than to the beginning, that those talks continue. They continue in a very robust, constructive way. And I would say we have made a lot of progress. There have been a number of issues taken off the table, a fair number indeed. There is a pathway to a deal. We are working hard to get to a deal. That is our objective. We are working constructively with the union, continuing at the table, exchanging ideas back and forth. And so I'm confident that we're going to reach a deal with Local 79, and we'll be able to go forward with the help of their very capable people to do all the things that have been described by my colleagues here today.
If there isn't a deal, how does that affect Toronto Public Health specifically?
Well, we have, some of the members of the bargaining unit are people who work for public health, and I can tell you right now, I cannot contemplate a situation in which we would be bringing about a work stoppage for those people or for Local 79 members, but I would think that the objective remains the same, which is to reach a negotiated settlement. We've shown that we can do it in the last 2 weeks with Local 416. We will continue to talk with Local 79. We have some time left in which to do that. In fact, most of the issues were, in effect resolved to get to a deal with 416 in the last 24 or 36 hours. And so that's exactly what we're going to do, because I think we can get a deal. That's the best way to go about this, and then people can just carry on with the good work that they do for the City of Toronto.
For Dr. de Villa or Chief Pegg, whoever feels would be best to respond. The TTC, the buses, the streetcars, the subways, people are crammed in like sardines on a daily basis. You can scrub the vehicles and disinfect them as much as you want, but how can you possibly keep those vehicles from becoming incubators for coronavirus?
So thank you for the question. I think the important part here is what we can do as individuals, right? At the end of the day, each and every one of us is the last line of defense in respect of a virus and in respect of acquiring respiratory disease and illness. So I know I've said it many times, but I will say it again because it bears repeating and it warrants repeating. Washing your hands is actually a very effective way to put up that last line of defense. So whether you ride the subway or whether you, are commute through other means, I think there are important infection prevention and control measures that each and every one of us can take. And of course, staying home when one is ill will also allow for continued safe environments, whether we're talking about public transit or otherwise.
Thank you. Quick follow-up. Chief Pegg, you mentioned level 1 to level 2. How many levels are there? What can still come?
So there are, within the definition of our emergency plan, there are 3 levels with respect to Emergency Operations Center activity. Level 1 is, of course, the lowest. That's we will, from time to time, operate or open at level 1, really from a monitoring perspective and to provide some core coordination or baseline coordination across the city, depending on what the incident is or the issue is. Level 2 transitions us into 24-hour operation and provides a significant enhancement to the amount and I would say depth of coordination and support that each of the city divisions will receive from the Emergency Operations Center and from the Office of Emergency Management. So we're presently, as I said, we're moving to level 2. The final and highest level would be level 3. That is extremely uncommon, and we would only get there in the event that this situation were to escalate to the point where we required the transition from what today is, in essence, a senior leadership team managed event based largely on the advice and the expertise of Dr. de Villa. A level 3 would trigger us transitioning into an emergency operations center-led event, whereby, in essence, the city's senior leadership team and key decision makers would be around the emergency operations center table on a 24-hour basis. So we're presently at 2. There is 3 in the system. Whether we get to 3 will largely depend on what happens as the global situation changes. But as of today, I'm confident at level 2 there is a significant number, a significant capacity of resource that is afforded at level 2, and that will meet our need nicely at this point.
So some countries have closed schools, and some cities have closed schools as well. We're coming up here in Toronto on March break. Should parents start considering whether they need to think about alternate childcare when they come back from March break, maybe extending March break?
So again, thank you for your question. You're quite right. These are the kinds of activities that have happened in other jurisdictions, premised on their local circumstances. As we talked about here, at this stage of the game in the City of Toronto, our new cases seem to be related to travel outside of Canada, including the United States. This being said, we're approaching March break, which in effect is a school closure. But, with respect to what might happen thereafter, as Chief Pegg has described, this is a rapidly evolving situation, and things are changing truly on an hourly basis. So at this stage of the game, there is conversation. I know that there are many discussions in respect of other public health measures, including school closures amongst them, and consideration as to how best to implement those measures. So for now, the recommendations that I've made are the ones that are going forward in respect of the city, but know that there is constant evaluation as to what the situation is here in the city and throughout the province. But with larger public health measures, as I mentioned in an earlier answer to a question, when we're talking about those larger public health measures, and just given the way people move about and the mobility of folks in the GTA in particular, when we're going to go to larger public health measures, they're much more effective when done at a higher level, at least regional and optimally provincial.
So just a follow-up question. I mean, the optics are like we're looking at canceling meetings. Any student can expect to find themselves in a classroom that's the size of a meeting, or a cafeteria that's the size of a gathering. Who's involved in making the decision about whether the schools will be closed? Who's in on that discussion, and who makes the decision?
Well, I can't speak specifically to the names of the individuals who are engaged in that decision-making process, but I would well imagine that you would have folks, and I know that some of the folks who've been participating in those high-level discussions are our scientific agency. We have colleagues, public health experts at Public Health Ontario. We certainly have some expertise at Chief Medical Officer of Health and Associate Chief Medical Officers of Health at the Ministry of Health. And certainly I would imagine that this is an issue that our colleagues at Ontario Health and their command table overseeing the response of the province, including the healthcare system, would be actively discussing. But again, with March break currently about to start, that is in effect a school closure. So there is some time to think about how best to respond and what next to do, particularly when it comes to those larger public health measures that will be more effective when done on a larger scale.
Sorry, is it the province who decides, or the city who decides? Who decides?
So again, for those things that are at a larger scale, it should be done at the provincial level.
So let's say that I need some help. I need to call 311. I've got symptoms. I'm not sure whether or not I might be coming down with the virus. We've heard anecdotal stories about people not being able to get a timely response from 311, so what should they do?
So, we certainly regret when people are unable to get a timely response, and we are monitoring that situation very carefully. At Toronto Public Health, we have a hotline as well, and we know that we have partners at telehealth also seeking to provide advice, particularly for those individuals who have signs and symptoms of illness. I can tell you that we have had conversations between those who are overseeing the operations at Toronto Public Health Hotline, at 311, and at telehealth. We are all actively working together to try to make sure that we're able to provide as timely a response. And I realize and I regret that we haven't always been able to meet that standard, but I can assure you we're constantly looking at this every single day. We have added new resources all the time at Toronto Public Health, and we're trying to as well encourage members of the public who have technology available to them and are comfortable to use technology. If their issue is one of a question, we're asking them to go ahead and look at our website. We've got lots of frequently asked questions there. But we are constantly working on trying to provide better service on the telephone lines.
Could you shed some light on some of the steps you're taking to improve those response times?
Well, some of the things that we're doing, in addition to adding more human resources and more agents available to take calls, are things like trying to introduce self-assessment tools so that people can actually undertake their own assessment without having to have somebody walk them through it. We're trying to figure out whether, I know that with assessment centers coming on board, that provides another venue to help support those who are experiencing symptoms. And we're trying to figure out whether our other partners might also be able to increase their resources and to increase self-assessment tools so that we have more capacity on the lines.
Now that a child has tested positive for COVID-19, is the city considering canceling March break camps at all?
So with respect to March break camps, I may turn it over to some of my colleagues as well, but they would be subject to risk assessments like any other. I think the idea is how best do we assess gatherings as they're occurring? How do we determine the risk? So, and it's more than one dimension that's required. Numbers of people, numbers of participants or attendance is only one feature of a risk assessment process. So those kinds of gatherings, those kinds of events should undertake the full risk assessment. Certainly we at Toronto Public Health are happy to provide assistance where we can in those risk assessments, but I think the guidance document is actually quite effective in terms of providing good supports to those who are considering or who are organizing those kinds of events.
And what advice do you have to parents who have children in these camps next week?
The advice that I have for parents would be to, again, they have to take and think about their own risk tolerance. We all have slightly different levels of risk tolerance, but regardless of that, it would be good infection prevention and control advice, which I realize is not always easy with young people, but to the extent that we can make it easy for them, we should try to do so. Encourage hand washing, encourage the use of hand sanitizer, encourage good infection prevention and control measures. These are really the best things that we can do.
Can you tell us about the baby boy under the age of 1 who contracted the COVID-19?
So I, as most of the press here know, I don't discuss personal health information or specific case details. So I'm sorry.
So you would know how he contracted the disease?
Again, I won't be discussing specific case details in order to protect the privacy, I should say, of individuals.
Hi. Further to the March break questions, for example, all of my friends are planning on traveling all over the world to Hawaii, Mexico, Dominican, ski trips. You're not discouraging people from traveling, and you're not requesting people to perhaps go into quarantine afterwards. I'm just wondering what you are recommending, because March break is going to be a time of significant travel, and I'm wondering if you're concerned about bringing back cases here, because I've got, as I said, all of my friends are traveling, and we all have a lot of children. So just wondering what your opinions on that are.
So with respect to travel, first and foremost, we would advise people to look at travel advisories that are provided courtesy of the Public Health Agency of Canada. Second, whether you're traveling or not, the good infection prevention and control practices are the mainstay of protecting oneself and one's family from respiratory illness. And finally, as I mentioned through my remarks, we're asking people who have traveled outside of Canada. They are extremely important. They have a huge role to play in respect of delaying the onset of community spread in our city. So we're asking them to vigilantly monitor themselves, to be extra careful around monitoring for signs and symptoms of respiratory disease. We're asking them to be really good about hygiene, and we're asking them to avoid contact with those who are older, with those who have chronic disease, and where possible, to avoid those group and public gatherings so as to minimize the possibility of community spread.
But a school setting is a very public setting. My children's school has more than 500 students. And you know what little children are like, fingers in their mouth, all their orifices, nonstop. So it's easy enough to say, wash your hands to my kids, but they don't always do it, and they're constantly putting their fingers in their mouth, et cetera. So I'm just wondering, if when people come back, especially since children oftentimes don't have very significant symptoms, what you're asking parents to do when they come back from March break with their kids.
So as we were talking about earlier, I think there are some active conversations happening around what might occur at a larger level in order to minimize the spread. But it doesn't take away from the fact that good infection prevention and control practice, good hygiene, is still fundamentally the mainstay of protecting oneself and one family from disease.
Okay, this is last question. Last but not least. Hi, Dr. de Villa. So our shelter system in the city, of course, we know it is really always jam-packed. Many people who make use of the shelters in our city are transient individuals. How do you ensure that people attending shelters in the city, there's not, an outbreak amongst the shelter system? Are they going to be tested as they walked in, or is it just like everyone else, you have symptoms, report it?
So clearly, we know that shelter settings house some of the most vulnerable members of our community, and that's certainly a concern for us. We at Toronto Public Health have been working actively with our partners at Shelter Support and Housing Administration to ensure that plans are in place to support the clients who use our shelter services and other services in the homeless sector, and to protect them as best as possible from COVID-19. I don't know if there are specific...
Marion, why don't you provide a couple specifics?
If you can provide some insight, and I have a follow-up for the mayor on shelters.
Sure. So as Dr. de Villa said, there is no local transmission, and so the risk to the homeless population does remain low. However, we are taking all the steps required to plan if we need to escalate the actions that we're doing. So we are increasing expectations around shelters following cleanliness and IPAC sanitation processes. We are working very closely and starting to screen people about their travel and their contact with people that have traveled, and just remaining very vigilant on our own staff and the travel that they might have undertaken.
Thank you. One quick question for Mayor Tory. The CUPE Newser, with CUPE 79, which was just before this, this was said in the Newser, I believe was the president who spoke, I wasn't there. 10 long-term care homes, city shelters, public health workers will be affected if the strike happens. Now, the message from the city last week is that they won't be impacted, and this is what we're hearing again today from this group here. Can you ensure that there will be no impact to these services if CUPE 79 goes on strike as of Saturday?
The best way for us to ensure that there is no impact on these services, and we are going to have plans in place to make sure that that's the case, but the very best way to make sure of that is to reach a collective agreement. And that is what we're continuing to do. That's what we're going to do. We were doing yesterday, we're doing it today, and if we don't reach an agreement by tonight, we'll keep doing it tomorrow. But the objective is to keep going to reach an agreement. But I will tell you, as was outlined by the city manager last week, that we have plans in place to make sure for all of the services provided by members of Local 79 that in the event there is a work stoppage, and I indicated to you today it was highly, highly unlikely that I could ever see us initiating one, but if there was a work stoppage, that we would have plans in place to make sure that we carry out our responsibility, which is to make sure that all of the services provided by Local 79 members are provided to the people of the City of Toronto on a prioritized basis, and certainly the places you mentioned are of a very high priority when it comes to looking after people who are quite vulnerable or looking after public health related issues. Thank you.